I'm happy to be here today. It's been a while since I've seen a lot of you, but I appreciate the opportunity to share what we're doing in Chester County. We started very early in January. Our health department, which we're very lucky to have, came to us and said, there's something going on in China and we're going to start following it because we're a little concerned. So we were able to put plans in a little earlier than some, I think, because we were really ahead of the curve. But before I go on and tell you what we've done, I just want to let you know that we have also taken over Delaware County's health department. And we did that because they were struggling and they needed help. They were part of the state's health department, and we have our own, as Montgomery County does and Bucks County does. So we adopted Delaware County. And so pretty much everything I'm going to talk about is related to both counties and not just one. So I just wanted to make that clear. Some of the early things we did was we started to look for PPEs when we saw that there was going to be a need in mid-March. And we actually today, we have sourced 3.5 million pieces of N95s and surgical masks, which we have sourced for Berks County, Delaware County, Chester County, all of our hospitals within those counties, and all of the emergency operations centers. So we've sourced a lot of pieces, but they're being spread out among the whole region. We were extremely early in getting that, thank goodness. They're good supplies. We got them from China. They're always wary, but we were very lucky, and most of them have been delivered. So we're extremely lucky from that perspective. The other thing we did was we went out to source testing, because as the data was coming in and the news was coming in, we could see that the need for antibody testing was growing. And fortunately for us, I was introduced to a company that is a local company, a Chester County company, that has an antibody test that tests for IgM and IgGs. And we actually are now working with them to supply tests. The problem we're having is they haven't gotten their final approval from FDA, and that's taking a little longer than everybody had hoped. So right now we are testing with the antibody tests our prison, because we can do it there, our senior living facility, Pocopson Home. We have given kits to all of our long-term care facilities, and we have given kits to the hospitals so they can test their doctors and their nurses. We cannot, however, go out community-wide without this piece of paper, and it's lagging behind. But meanwhile, we are testing the critical infrastructure of Chester and Delaware counties. So we are working towards the end goal, which is to test the community. And the reason we want to do that is because that will give us the information we need to know who can go back to work safely. Because we are concerned, all of us are concerned about a new rise in these cases when everybody goes back. And so we want to try to be as careful and as considerate as we can be. We've also sourced 30,000 swab tests. And we are using those again in our prisons and our healthcare facilities. So that's been very helpful. We're looking to do as much testing of any sort as we can. It's good to have the data. It's good to be able to know whether people have been infected or not, and whether they have the antibody. That's the long-term goal. So as I gave you all of our testing tier number ones, the priorities were our senior living facility, our youth detention center, our prison, hospitals, long-term care facilities. As you know, long-term care facilities are really struggling right now. And 64% of our cases in our county are from long-term care facilities and institutions. So that is something we really are working very hard with right now to try to help them in any way possible. The goal is to get the economy back, but we need to do it safely and making sure that everybody is healthy. And we're dealing with that every day. The sanitizer situation was really difficult. Who knew sanitizers would, take over the market? But recently we were very lucky. We partnered with a distillery, and they partnered with Wawa. And the three of us put together bottles from Wawa of sanitizer made from the distillery. And we had 800 gallons that were delivered to us last week. which we are sharing with all our long-term healthcare facilities, again, our prisons, our emergency responders, and those kind of people. We're very lucky to have those public-private partnerships there. They're one of my favorite things. So that's a background of kind of what we are doing. We've also had many town halls for the business community and the general community, especially on health and mental illness, because that is picking up, right? We see our calls coming in of people that are really struggling with mental illness, those with addiction that can have that one-on-one personal relationship or go to AA meetings. That's a struggle for people, and we're trying to figure that out to give them as much support as possible. And the last thing, because I know you have a big agenda, I will mention is we want to make sure that we mail in our ballots. We don't want people at the polls standing in line with the potential of getting this illness. We do not want it. So we have made great strides in our county, and I'm sure the other counties have as well. We have now 37,000 requests for ballots that have come into our county, which has never happened before. So please spread that word. We don't want people ill. And the last thing I will leave you with is the census. So the census is critical to funding for all of our counties, including the city of Philadelphia, for mental health, for all the things that we need to do to protect our citizens and help them in any way we can.